so how to figure out you have celiac disease? Well, I guess the first part is your gut kind of tells you. It is kind of you notice that whenever you eat gluten or something that you get really sick. And then you typically start what I like to call the doctor shuffle, where you go to a doctor and you talk about them. And initially, celiac disease is often misdiagnosed as IBS, irritable bowel syndrome. Because you go to the doctor and you say, oh my goodness, my stomach always hurts whenever I eat rice, not rice, but bread and pasta and all these other things. And so doctor typically says, okay, well, you potentially have IBS, so here's some foods to avoid. And but things to look for specifically if you're thinking, maybe let's talk about maybe if your kid has celiac disease. Because celiac disease affects the way that your body absorbs nutrients, it's really hard to gain weight. And typically, like some of the kids that I've seen who were celiac and knew they were celiac growing up, they're super skinny. They are, I'm like talking super skinny. Like this one guy I know, this kid, he is super awesome. He is super tall, but he is a stick. Another thing that I heard is a symptom of being celiac is that you can break bones easily. Once again, we're going back to your body doesn't absorb nutrients like it should, and so you don't get the vitamin D or to the bones that you need, and so you break bones easily. Did I break a lot of bones while I was growing up? Yes. I don't know if it's because I was celiac or because I am celiac, or if it's because I was a very active young little man and wanted to do everything my older siblings did, and in the course of events would fall and didn't know how to fall properly. So those are kind of some of the major ones. You're tired sometimes people are tired all the time because you don't get the nutrients. When I have a celiac attack, what I call it, when I get cross-contaminated or eat gluten unknowingly, I just sleep for long periods of time. And it's not because I'm like trying to be lazy or trying to, like catch up on my Z's. It's because, it's kind of like not eating and then trying to survive. Your body needs to gain energy somehow, and sleep often is a way that it can try to compensate for that. And so those are some of the symptoms and try to figure it out. Really, the for sure way to figure out if you have celiac disease is to go to a doctor and to get some blood work done. Here's the tricky part about the blood work, however. If you're already living a gluten-free diet, then the blood work doesn't really work because it doesn't detect the antibodies that your body would be producing if you were on a gluten diet, and it's trying to compensate for that. One of the for sure ways to figure it out is to have a GI done, and they go and they look at your intestines, and they look to see if there's scarring, or they look to see if the villi are shorter, or if there's other signs and stuff that they can see. Obviously not preferable because those are A, awkward, and B, painful, and C, you don't like to drink whatever juice they give you beforehand. Lots of times celiac disease will run in the family. I've got an uncle who's celiac, I've got a grandma who's celiac, I've got a sister who's celiac, and so, but that's not always the case because my best friend is celiac and no one in his family has celiac disease. So he's just special in more than one way, but one way being celiac. And so that's kind of, it's really hard because you go through the doctor shuffle and they kind of put you through everything. As far as treatments go, once you find out you're celiac and you've accepted the fact that donuts are no longer a part of your life, which sometimes takes a while, then really the only treatment they have for celiac disease right now is to abstain from eating any gluten. Now there's always, some scientific articles or stuff coming around saying that they're getting closer to a cure for celiac, and which would be awesome, and many blessings upon the scientists who figure it out. But the for sure way is just to abstain from anything gluten and to live a gluten-free diet, which is very intimidating at first. I can remember when I was first diagnosed and you walk into a grocery store and it's just like, what can I eat? There's nothing here. It's kind of depressing. You see like happy people walking along with like all the bread and the donuts and all the good stuff in their cart, and you're over there like, well, here are some carrots and like maybe some beets, and like I'll go way out there and get some peanut butter. But it's really not that bad once you get used to the diet. You do have to get used to cooking gluten-free is a whole nother beast because the flours act differently than wheat flour. The way to not go about it. I heard of someone once who, this is comical to me, but they ate, Little Debbie snacks? They ate tons of Little Debbie snacks one night, like many packages of different Little Debbies, and woke up the next day and were like, oh my goodness, my stomach doesn't feel good. I think I'm gluten intolerant. I think I'm celiac. And it's like, no, that's stupid act. Like, if you eat that much junk food, of course your body's going to be like, I'm celiac. And so when you're, I'm jumping back and forth, but when you're trying to figure out if you're celiac or not, a good way to go about it is kind of also an elimination diet. And, where 1 week you eat gluten and you're very happy because you're eating gluten, but you're very sad because you're very sick all the time. The next week, you don't eat gluten, and you're very happy because you're never sick. And maybe you're sad because carrots are not that appealing. But after you keep a food journal, and after you keep the journal for a while, you start to see patterns and trends. And then that's a lot more useful information you can take to your doctor besides, when I eat food, I feel sick. So that's something that you can do, especially if you have a little kid and you're a parent. You really can control their diet to a large extent. Unless, they go to some nursery or daycare and they're holding the kid down and forcing like a muffin in his mouth. Which if that is, like, go to a different daycare. But track down everything that your kid's eating and see when they come talk to you about when they feel bad. You can also notice some physical symptoms. Obviously, like, you're going to spend a lot of time on the toilet if you've been cross-contaminated. Another thing is you often get bloated a lot. And so if you notice that your kid's stomach is like abnormally large and they look bloated all the time, that's not a for sure sign, but that's just kind of something you can be like, oh, Johnny, you look bloated. I'm not going to tell you, but I'm going to notice that. Write that down in the food journal after you've eaten. Say, okay, what did Johnny eat before this? Oh, it looks like Johnny had some graham crackers, which have gluten in them. And then you can say, okay, well, let's see if when Johnny is all the way off of gluten, if he still has this problem, if he still has all the diarrhea, if he still has some of the other symptoms that we've talked about. So in the end, though, maybe this sounds kind of weird, but the individual who has celiac or gluten intolerance has to listen to their body. And you have to listen to things like when your stomach hurts, or when you get diarrhea, or when you get massive headaches sometimes, or when you just want to sleep everything away. Not like you're in finals week and sleep your life and cares away, but you get contaminated and sleep. You have to listen to your body and be aware, because your body is trying to tell you what's going on. And so as you listen to your body, then next time you can say, oh, okay, I am not going to eat that bagel. I'm not going to eat that donut. I'm not going to eat that slice of bread or the homemade cake or whatever it is. And this is also where you start to get to learn random foods that have gluten in them. And so, yeah, those are, and treatments for gluten intolerance, sometimes at like a Walgreens or a CVS pharmacy, They've got like pills that you can eat, and apparently it's supposed to help you to be able to digest gluten. They don't work for anyone who has celiac disease because it's a whole nother beast. I have some friends who are gluten intolerant, and they say that sometimes it works for them. I can't vouch for them 100% because I'm not gluten intolerant, and so I don't know if they work for someone who is or not, but you could try them out if you're feeling very adventurous and up to being sick for a week. If you're not, then, just continue living the gluten-free diet. A large portion of people find out they're celiac probably during their childhood. And once again, celiac tends to run in families. And so if you've got a relative or a grandparent or a parent or a sibling who's celiac, then, take a good close look at your kids. But for me, I ate, growing up in my house, my parents' house, since my sister was celiac, I ate a pretty good gluten-free diet most of the time. And so we didn't notice the symptoms in me till I went on my mission, a 2-year mission for the Church of Jesus Christ of Latter-day Saints, where members of the church would feed us food, and all of a sudden I was having, gluten pretty much every day. And kind of from the get-go, from the start of my mission, I was having all these problems, and we didn't figure it out until after my mission. Also, disclaimer, because I was super stubborn, and I thought it was celiac disease, and I didn't want it to be, because I knew I'd have to change a lot of my life. But it's not really that bad. So I would have to say most people probably as kids, maybe teenagers. But it kind of also depends. If you grow up eating only Thai food, then you might not even know. And just because you don't have the symptoms, like the diarrhea and the headaches and the sleeping and the malnutrition, that doesn't mean that you're not celiac. You could still be celiac, just have different symptoms. So the best way is just go get that blood work done and then the GI.